The plastic surgery industry has survived and even boomed in America in spite of constant turbulence in the economy. But it might be President Obama's healthcare reform plan that finally impacts it the most. When it comes to plastic surgery, the biggest impact of the proposed bill, H.R. 3200, could be the removal of the patient's choice of insurer. Legislation is underway that, if passed, could shift American healthcare to a single-payer system overseen by the government. And the effects of this new plan could be detrimental to someone seeking plastic surgery for reconstruction rather than something cosmetic. For example, if a trauma victim requires extensive facial surgery after an accident, he may find himself limited by what the government is willing to pay for. The financial coverage and the treatment he gets may fall short of something complete, leaving him incomplete both physically and emotionally. Dallas healthcare attorney Michael Bird urges patients to become informed about the details of the proposed legislation and to speak up to their doctors and their government representatives about their concerns.
I would encourage everyone to be involved and follow the potential legislation that's out there. It's very up in the air right now, and there's nothing that looks like it has in its current proposal that has enough traction to get through. But if it does, it's going to be a significant impact to everybody. It's going to impact potentially your costs on cosmetic procedures. It's going to alter the business of a plastic surgery practice significantly, and you can only assume that that is going to be reflected to the patients in a way of increased costs. I think the biggest concern is that this thing is getting pushed through quickly, and that many of the patients and doctors are not aware of the potential legislation.
The healthcare attorney also noted that increased patient costs, shifts in the industry's business practices, and new benefits policies pertaining to cosmetic surgeons and their employees are some other possible effects if the administration adopts the proposed legislation in its current form.
Doctors absolutely need to get educated, and they need to get involved with their societies and with their representatives. This is going to have a dramatic impact on their provision of health care or medical services, and it's also going to impact the business. Their employees are now going to be subject to the same rules that any other businesses out there in the form of benefits and health care that you have to provide. We actually have recently just published a paper that can have some key points to what's going on that's available for both patients and the doctors to review.
The proposed health care reform legislation is sure to be the top priority for Congress when they reconvene next month after the August recess. But given the outpouring of opinions from constituents across both parties this summer, it may be a while before legislators come to an agreement. We'll keep you posted as news develops.